So I wanted to have a heart-to-heart with my vet teams out there. You guys are the front line. You are the people that can make the biggest change. And I've been out there talking to you. I know that you are just as frustrated with people that let their pets suffer and you don't understand. And it's so easy to blame the client and feel helpless because they do have the ultimate control of the decision, and you want to be respectful of them. You want to support them. Maybe you feel stalled by big emotions. I don't want that to stop you. Someone's emotions should not be an excuse for poor animal welfare. What I mean is, it's not okay to not say something because you feel bad about how someone feels while you're watching their pet suffer. And I'm not just talking about those obstinate clients that refuse to euthanize, that can't let go, and they're really bad. Those situations are bad. I do think we can prevent a lot of those if we're having talks and good education earlier. We don't want to be saving these talks until we're at the phase where animal welfare is a consideration. So what I want you to do is start providing good education at your senior wellness exams. Kind of like we provide good education at our puppy and kitten exams, right? We want to set them up for a good life. We want to set them up for a good ending. The end of life phase starts here. This is the beginning. This is where good education means earlier disease detection, knowing when it's appropriate to come into the veterinarian, knowing that starting some arthritis anti-inflammatory medicine is going to be much more helpful early on in the disease. And let's remember that arthritis is a terminal condition in pets. It ends in euthanasia when a pet is too painful to get up, and we need to treat it that way. I know there's still not a lot of education around what hospice really is. I just want to say here, hospice is not prolonging life. Hospice is not keeping a pet comfortable for as long as possible, not based on the human model, which is what I based my hospice on. Hospice is about letting go. It's about not prolonging life, because the reality is when we prolong life at the end, we are often prolonging suffering. So I want you to consider euthanasia, as radical as it may sound, preventative medicine. I have seen more suffering in my career as a euthanasia vet than I ever thought I would see. It's awful. It's the worst part of my job. People ask, is the worst part of your job seeing people cry? No. The worst part of my job is seeing animals in horrific states. Horrific. That is what has given me the passion to get this message out there, because I think it's worth it to prevent a day, a week of horrific suffering. I mean, I liken it to torture a lot of times. What I have seen is really bad. And this is at the hands, guys, of your best clients. I don't want you to be thinking about those obstinate clients. These are your best clients. These are your regular clients. These are your average clients. These are people that tell me they were just at the vet, or people that seem to be at the vet regularly. And that might be confusing to you, where you're like, I don't have anything else to do and I don't know what else to do. We want to be careful that we're not just doing last-ditch effort, throwing things at this pet. We got to be careful that we're not just giving gabapentin when we're at end phase of some kind of cancer that's breaking bones. We want to make sure our clients understand what pain looks like, and let them know what it's going to look like if we're covering that pain, so they can let us know we're not covering that pain. It's not appropriate to keep a pet alive with prolonged suffering. And oftentimes, like I said, what feels like torture of its own body. I've talked to many clients who tell me it's more humane to euthanize when they think about how they have had to watch their own human family members suffer at the end. And now remember, you cannot compare a human who's on IV opioids to a pet at home with gabapentin, where when I talk to clients, they're not even giving it round the clock. So we have to be very careful when we are also comparing human life and pet life at end of life and what's really available for them. Now, we are fortunate to have euthanasia, which, like I said, is preventative medicine. But it's only preventative medicine with the right education and resources. I want you to at least go through this pet resource library and see what I'm teaching clients. And if you want to get a deeper understanding, I encourage you to purchase my course. That's a full consultation series. It's about 80 to 90 minutes. It's broken up in 5 video parts. And I go into deep explanations of quality of life and pain and how to recognize that in a pet. And the reality is many of us did not learn that in school. And so it's important for you to make sure you understand the basics. And then it's also really helpful for you to see how I explain these things to a client so you can mirror my language when discussing these difficult topics. I hope you'll join me. I cannot do this alone. The minimum you can do is share this free resource library with every pet parent at their senior wellness visit. Ask them to go through the library and to come back with notes at their next visit. You may be surprised, people might be calling you more often and earlier.